IUI is recommended for women with cervical cause of infertility. So if a woman is having autoantibodies in her cervix, so when you try naturally at home, the sperm gets deposited in the cervix. So when you have autoantibodies, the sperm will be destroyed and hence no sperm can go inside the uterus and fertilize the egg. IUI must not be done in women with both the fallopian tube blockage and in men with azoospermia, that is absence of any sperm in their semen. So once the sperm is prepared, the semen has to be injected into the uterus in next few minutes, maybe in 5 to 10 minutes. 10 minutes itself is little high, within 5 minutes it must be injected. So when you put gonadotropin injection, rather than having one follicular growth in that month, you can have 2 to 3 egg growth in that cycle. So this will increase your success rate of IUI. Hi, this is Dr. Reshma Shree, fertility super specialist. Today let's discuss about IUI. So IUI means intrauterine insemination. So in this procedure, usually when you go to a fertility center for your infertility problem, they recommend you as a basic procedure. It is a very simple procedure and a cost effective procedure. It does not cost much. So in an IUI procedure, they clean the semen of husband and they inject it into the uterus of women through the help of a plastic tube which is called catheter. Usually IUI is recommended for women with cervical cause of infertility. So if a woman is having autoantibodies in her cervix, the sperm gets destroyed by the autoantibodies. So when you try naturally at home, the sperm gets deposited in the cervix. So when you have autoantibodies, the sperm will be destroyed and hence no sperm can go inside the uterus and fertilize the egg. So if you have cervical stenosis or any infection in the cervix, or if you have increased mucus secretion in the cervix, all these will contribute to infertility. These can be overcome when you do an IUI. Otherwise, there is male cause of infertility, like if the count of the sperm is less than 15 million or the motility is less than 40%, or if the morphology of the sperm is less than 4%. In all these conditions, you can do IUI to improve your success rate. So IUI must not be done in women with both the fallopian tube blockage and in men with very low sperm count, or when there is azoospermia, that is absence of any sperm in their semen. So in these conditions, there is no use of doing IUI, hence it is not recommended. So when you are planning for IUI, the couple has to come to the hospital on the women's day 2 or day 3 of her periods. We will do a basal scan. If the scan is good and if her hormonal tests are good, then we can start her on ovulation induction medicines and she can take that for next 5 days. And the women has to come to the hospital on day 6 or day 7 of her periods and follicular monitoring can be started. So once the follicular monitoring started, based on her follicular growth, certain gonadotropin injections will be given. So usually when we put gonadotropin injections, patients will ask me, I have good follicular growth and I have good follicular rupture naturally. Why should I go for injections? So when you put gonadotropin injection, rather than having one follicular growth in that month, you can have 2 to 3 egg growth in that cycle. So this will increase your success rate of IUI. Other than increasing the growth of the follicle, it will also increase the quality of the eggs. Hence the chance to conceive that month increases. So once the follicle becomes 1.8 to 2 centimeters, follicular rupture injections will be given and then IUI can be planned. So if you are going for single IUI that month, so what you can do, you can come to the hospital after 34 to 40 hours post your rupture injection and then you can give your semen sample for IUI and it will take around 1 to 1.5 hours for semen preparation and you can plan IUI accordingly. So if you are going for a double IUI, then it means you are going to do 2 times IUI in that cycle. So what you can do, you can come to the hospital 24 hours post rupture injection and complete your first IUI. And post rupture you can come maybe on next day around 34 to 40 hours after your rupture injection and confirm a scan that your eggs have ruptured and you can go for an IUI, that is your second IUI. You can prepare sperm by 3 methods. So one is simple wash technique. Second is swim up method. This is the usual technique which is followed in many fertility centers. Third is density gradient method. Usually when you do density gradient method for preparation of sperm, it will increase the chance to conceive that month. This is because you use special medias for sperm preparation. So, once the sperm is prepared, the semen has to be injected into the uterus in next few minutes, maybe in 5 to 10 minutes. 10 minutes itself is little high, within 5 minutes it must be injected. So, once the sperm is prepared, it has to be kept in a warmer in appropriate temperature, that is around 37 to 38 degrees Celsius, and then the sperm has to be given to the doctor and it has to be injected inside the uterus. So, the injecting technique also should be very slow and should be done patiently, and once you take out the catheter must be taken out very slowly. You take it out with full force, because of the force the sperm will backflow out to the cervix, and this will reduce their chance to conceive that month. So, following IUI, you have to take rest for next 15 to 30 minutes and then you can go home. So, once you go home, you can continue your routine activities. So, if you are going for work, you can continue going for your work. If you are mopping, if you are cleaning your vessels, if you are sweeping, if you are doing any washing of clothes, if you are doing any work, you can continue your work. It is the same natural method which you are trying with the help of doctor, and the sperm is getting washed. Other than that, every mechanism which is happening inside the body is the same natural conception method. So, you need not take any special bed rest or have any restriction in your food habits during this period. So, post IUI, you can have contact at home on alternate days for next 3 to 4 days. So, following that, for next 15 days, you will be given certain progesterone medicines. You can continue the medicines along with folic acid, and then after 20 days of your IUI, you can check your urine card test. If you are not getting your periods, suppose you are getting your periods, please come to the hospital. We can go for further evaluation, find out the cause for failure of IUI, and then we can plan second IUI. So, usually when the couple gets negative result after first IUI, half the patients stay at home with depression. They do not go to the hospital for fertility checkup for next maybe 1 year, 2 years, even for 10 years, thinking that pregnancy is not possible after one IUI. So, always you should keep in your mind that one cycle of IUI will give you success rate of 10 to 15%. If it is really indicated patient of IUI, then your success rate is 50% even when you do the IUI for the first time. So, you have to do IUI consequently for next 3 cycle to get success rate of around 50%. We do not recommend patient to have IUI more than 3 to 4 cycles. So, I get lot of patients who come to me after doing IUI for 10 times, 12 times. This is totally waste of money, waste of your, what to say, it is going to be an emotional stress and it is going to affect the health of the women. So, there is no point doing IUI more than 3 to 4 times. As per recommendation, it is 6 times. But when you do IUI for 3 times, your doctor, your fertility consultant will know whether you will get success after your third IUI. So, once you get negative result after first IUI, go to your consultant, find out the causes for failure of IUI. Once you find the cause, you correct it, and if you are indicated patient, definitely you can have success in IUI. But always you should have in mind that IUI is not a 100% guaranteed procedure. So, any procedure will have its pros and cons. You have to understand the pros and cons and plan your pregnancy accordingly. So, today we have discussed in detail about IUI. So, who should do IUI, who should not do IUI, what are the steps of IUI, how should you follow post IUI. So, all your doubts could have been cleared in this video. If you have any further doubts, please contact the helpline number above. Please come with your reports. We can have a detailed discussion. Thank you.